Okay.
Awesome.
Right. Hi, everybody online. We're gonna. Oh, what's that?
Just wait for that to pair.
All right.
Yeah.
Okay.
As soon as that flashes green, then you're live.
Right. Okay. Can everybody online? Somebody give me a thumbs up if they can see and hear us. Yep. Right. Thanks. Okay. We're just waiting for a few more people, and then we'll get started. Right. Okay, I'm going to get started. Right, so thanks everybody for coming. Those of you who made it in person, and it's really unpleasant out there, but so thanks for that. And we got quite a few people joined online as well. Okay, so this is the induction for new postgrads research students in the Institute of Population Health. So I'm going to talk a bit about, sorry, to introduce myself, my name's Gavin Burnside. I'm the Director of Postgraduate Research for the Institute. And we'll introduce other people as we go along. So I'm just going to start by giving a little overview of the Institute. And then we're going to have a little bit from each of the department postgraduate leads, who will be sort of your main contact within your departments, but also to give a bit of an overview of what goes on in the other departments within the Institute. Okay, and then we've got then we'll talk a bit more about PGR and your journey throughout the years you're here. We've got someone coming to talk a bit about health and safety, and then we have the Department of Disability contact, and then then Alice, who is here, who's one of our PGR student representatives, is going to talk about, and then we'll finish with a Q&A. Okay, so basically, if you don't know what IPH is, we've got the university structure is there are 3 faculties within the university. There's health and life sciences, science and engineering, and arts and humanities. Within health and life sciences, there are 4 institutes. And we are in IPH, Institute of Population Health. The other ones, I'm not going to try and remember exactly what they stand for because I've forgotten. But I know roughly what they are. So anyway, within IPH, so all of you will be in one of the research departments in IPH or in the school, and we'll talk a bit about each of these 5 departments and the school, because there are PhD students across all of these. Okay, and I'm not going to go too much detail on this slide because we're going to have the individual PGR leads talking about this, but the 4 departments are primary care and mental health, health data science, psychology, public health policy and systems, and then, as I mentioned, the school, which is the School of Allied Health Professionals and Nursing. Okay, so before I go into more detail about the PGR thing, we're going to go around the departments. So firstly, Gemma, if you want to come and talk a bit about primary care and mental health. Just hold on to that.
Okay. Hi everyone. So like Gavin said, my name's Gemma. I'm a senior lecturer in clinical psychology in primary care and mental health, and I work as a clinical psychologist in the hospital just over the road as well. And I'm the PGR lead for our department. So I'm going to explain a little bit about our department today. Is anyone a PGR student within primary care and mental health in the room? Great. Nice to see you all. So you'll be seeing lots more of me over the next sort of few years. I'm sorry in advance. So like Gavin said, sort of we're part of one of the 3 faculties within the university. We are in the institute and we're primary care and mental health highlighted there. You can see how we fit across the entire faculty here. So there's lots of different bits. And you may or may not come into contact with some of these different bits as you continue so your postgrad studies with us. So what is primary care mental health? So we're relatively new as a department. So I've worked at Liverpool since 2009 and the institute's changed, the departments have changed. It used to be IPHS, so Population Health and Society, was it? Yeah. So these presentations are really tricky because I feel like my head's about 10 years behind where the university is. So forgive me if I get anything wrong. But we used to be part of a large department of psychological sciences. And then we branched off into the Department of Primary Care and Mental Health a few years ago, maybe 3 or 4 years ago. So we're still quite new. And I'll talk a little bit about the sorts of research and teaching that goes on within our department and how we're distinct and overlap with other departments. But people you may come across, particularly if you're in primary care and mental health, we have a new head of department as of 2 months ago, Edward Chancellor, who's a GP and a professor of primary care. And then we have a number of different committees within our department that each take responsibility for planning goals, strategic planning, thinking about priorities. So I'll talk a little bit about our PGR committee. And again, you'll hear a lot from me in relation to that committee over your studies. But our department is kind of structured according to different pillars. So we have leads for research and impact, for education, for equality, diversity, inclusion and wellbeing, and for communications, obviously PGR, for anything clinical related, and then health and safety. And within our department, there's a number of different research groups. So if you're a PGR student, you may be aligned with one or more of these research groupings. And we essentially do research at the interface between primary care and mental health, as the name would suggest. But within that, we do lots of different aspects. So we do research into complex intervention development, into the development of mental and physical health difficulties across the lifespan. There's a lot of work in collaboration with partner organisations abroad, looking at global mental health challenges and priorities, specifically thinking about reverse innovation. So how can we take what is known to work in low and middle income countries and apply that to a healthcare system in a high income country? There's research groupings, particularly around dementia inequalities and social care, a big research emphasis on perinatal mental health, primary care, understandably, public mental health, and then sort of vision, orthoptic and brain injury. But there's also loads more within that. So there's people doing forensic mental health work. I work in physical health, so looking at the interface between mental and physical health and why some people may be more prone to others to developing mental health difficulties as a result of living with a long-term physical health condition, thinking about clinical communication and decision-making in those contexts. So a lot of our work is cross-departmental as well. And as the other research leads come and speak to you, you'll see that there's quite a lot of overlap, particularly in the work that we do with psychology, with public health, with health data science. We're home to the ARC, so the Applied Research Collaborative, which is an NIHR-funded organisation that does tons of research and capacity building within our local kind of northwest area. We're also home to EMRIC, which is a mental health research and innovation centre in partnership with Merseycare. So there's lots of opportunity to partner with NHS organisations in our region and to be supported by some of the infrastructure. Our only taught programme is a doctorate in clinical psychology. So that is a 3-year programme that hosts around 120 to 140 trainee clinical psychologists at any one time. They're funded by Merseycare to do a 3-year doctoral programme, which comprises academic work, lots of placements in and around our region, different mental health settings, and then a 25,000 word thesis. So we're unique in PCMH in that when I'm talking about PGR students, it's postgrad PhD students, but it's also our doctorate in clinical psychology trainees as well. Okay. So thinking about postgrad research within PCMH, at the moment we're home to 28 PhD students. Most of these are registered and actively sort of pursuing their studies. Some have gone to submission pending, which means that they're about to submit for Viva examination, and one person is about to have their Viva or has had their Viva since I put this slide together. We've had a couple of new starters just this month alone, and there's one more planned within the next month. So although we're a small department, there's a nice PhD community. And when I talk a little bit about my role as PGR lead, I'll speak about some of the networking opportunities and chances you'll have to get to know other PGR students. At the moment, we have about 145 clinical psychology doctoral trainees as well. And they're split broadly evenly between year 1, year 2, year 3 and post year 3 of their studies. So it's a bit of a tricky role as PGR lead here because I'm trying to coordinate PhD and declin needs. So what I tend to do is focus on PhDs as an entity and then think about clinical psychology trainees in my role as research lead on that programme. So you will meet other trainees, but I don't tend to integrate too much just based on prior feedback from PhD students. So we are in a committee and we meet every 3 months and we talk about any issue related to PGR supervision, support, training needs, social needs within PCMH. We have 5 representatives from PhD students on that committee, and we have a declin trainee on that committee as well. If you'd like to join us, please do. We'd love to have you on board. It's not that much of a time commitment, but it does give you a chance to kind of have your say in what we do, how we support you, allow your voices to be heard. I've implemented a year lead system recently, so everyone will be allocated a PGR representative depending on the stage of their PhD studies, and I'll talk to you about that in a moment. But we have lots of initiatives in PCMH as well. So we have a monthly journal club that's run by one of our PhD students. We run regular in-person and remote meet and greets. And the things that we plan are all kind of responsive to what you want. So if you come and say, I'm feeling a bit disconnected, we'll think with you about, okay, how can we foster some relationships between our students? So keep your eyes out for emails. So Guida is our year 1 PhD representative. She's in year 1 of her PhD and she's a GP by professional background. And she will email anyone that's in year 1 full-time or 1 and 2 part-time just to ask how you're getting on, see if there's any issues you'd like to raise. So kind of is a little bit of a conduit between the committee and early years PhD students. And then we have Natasha, who does year 2 or 3 and 4 if you're part-time. Helen, who does year 3, the equivalent part-time, and Andrew, who does year 4 onwards. So keep your eyes out in your inbox. And any difficulties, you can either reach out to me or to your year leads. If you'd like to come and join us, or you just have any questions, or you want to know a little bit more about the department, you want to go for a coffee, just get in touch. It's always really nice to meet new PhD students. And as PGR lead, that's kind of my role. I want to get to know you all. I want to know what you're struggling with and what we can support you with. I want to hear your voices. So that's my email there. I'm looking at you 3 because you are my target audience, so apologies. But yeah, get in touch, drop me an email, and keep your eyes out for emails from me as well over the next few years of your studies. Okay. Does anyone have any questions about PCMH before I step down and let David take the stand? No? Thank you all very much for your time.
Yeah. So, hello everyone, I'm David Hughes. I'm a lecturer in health data science and I'm the PGR lead for the Department of Health Data Science. I can see 3 of the new PhD students from health data science, and I think I've spoken to most of you already at least. For the Department of Health Data Science, here's a picture from our away day, which we have each year. So some of the department at least are on there. We were at Cornerstones Park last year. We've been to Chester Zoo and other places as well, haven't we? We've had some good away days. We currently have 23 PhD students in the department, and at least 1 more due to start in the next month or so. You guys will know that if you have any concerns, you come speak to me. I'm your first point of contact. As Gemma said, look out for emails from me. So in health data science, our head of department is Marta Garcia Fignana. We teach a master's in health data science. Some of you have actually come from that program, which is great to see. So that's our main teaching program, and then we teach on various other things across the university where they need statistical help. And if any of you would like to get involved in teaching opportunities, drop me a line and I'll try and arrange that for you. One of the things I think is good about the Department of Health Data Science is that we're a collaborative kind of department, and we work across a lot of the other departments in the institute and across the faculty, and that seems to work really well and give some good opportunities for applying statistical methods and data science methods to a lot of different areas. I should say too, I haven't listed it on the slide, but I should have that Alice and Holly are our PhD reps in the department, and are very good at keeping all the students together and organising activities. And so look out for emails from either me or from them for opportunities to get together. We have 4 research groups in the department, some of which are quite expansive. So I'm part of the statistical modelling group, and we do all kinds of statistical analysis in lots of areas. We have a statistical genetics group and pharmacogenetics, that kind of stuff. And they collaborate widely across the institute. One of our bigger groups is the clinical trials group, and I know at least one of you is part of that, doing all kinds of things to do with analysis of clinical trials and setup of clinical trials and methodology loosely connected to trials. And then we have a large evidence synthesis group as well. So most of our work fits into one of these categories, and there's lots of opportunity to collaborate between groups as well. I think that's all I need to say.
Okay.
Any questions for me or else?
Okay, thanks. So we don't actually have so I think next on the list we've got public health policy and systems, and the lead for that couldn't make it, but has recorded a short presentation. So hopefully the sound will work on this.
Hello everyone, and welcome to you all from the Department of Public Health Policy and Systems. My name is Rebecca Geary and I'm the academic PGR lead for our department. I'm really sorry I can't be with you in person today. I'm at a conference, but I hope this brief introduction to our department is helpful. So the Department of Public Health Policy and Systems is one of the largest of its kind in the UK, and it has a world-leading status for its excellence in research and education. Underpinning all our activities is the social model of health and its application to health inequalities. Our overall aim is to improve the health and well-being and life chances of societies across the globe by conducting applied health research which is scientifically robust and practice and policy relevant. Our mission is to contribute to the improvement and maintenance of the health and reduction of health inequalities of people locally, nationally and internationally. And we do this through excellence in education and research, providing a learning environment to support staff and students to fulfil their potential, and the formation of constructive links with Liverpool and the wider communities to help us contribute to local, national and global policy and practice. As a department, our research aims are to understand the pathways that lead to inequalities in health and in access to health services, and to develop and evaluate interventions and policies at the community and population levels to ensure health and well-being for all. They're also to engage policy and practice communities to ensure policy relevance and support the incorporation of our evidence to directly benefit people in their day-to-day lives. Our department has a critical mass of more than 80 researchers contributing to our key research themes. One group look at policy research on social determinants and health inequalities. This Health Inequalities Policy Research Group, or HIPPA, focuses on how to improve the systems society needs to put in place to promote, sustain and protect health, prevent disease and care for the sick. We aim to understand the pathways that lead to inequalities in health across the life course and develop policies and interventions to tackle inequalities in the wider social determinants of health and well-being. We're involved in major local, regional and international research programmes, including the new Children Growing Up in Liverpool or Seagull birth cohort. The Non-Communicable Disease, or NCD, Prevention of Food Policy Group delivers world-class research to analyse, interpret and promote effective, equitable and cost-effective policy interventions to promote health and prevent non-communicable diseases. Recent work has demonstrated big opportunities for disease prevention at population level and have informed governmental policies underpinning UK dietary sugar and salt reduction and EU trans fats regulation. Our Energy, Air Pollution and Global Health group focus on household air pollution, one of the biggest global public health issues, responsible for 2.3 million premature deaths in 2019. Through the NIHR-funded Clean Air Africa Global Health Research Group, they've conducted a programme of mixed methods implementation research, directly informing national and international policies to scale access to and adoption of clean household energy. They collaborate closely with the World Health Organization's Department for Environment, Climate Change and Health. In health systems analysis, we undertake research on concepts and functions of health systems and health policy, drawing on expertise in health services research, health data science and informatics. And in social sciences of population health interdisciplinary collaborative, or SOFIC, we advance and strengthen social science approaches in and of population health, focusing on biosocial inquiry and methodological pluralism and interdisciplinarity. The department leads and participates in many collaborations and initiatives. Just a few given here. We have the NIHR School for Public Health Research through LILIC, the Liverpool and Lancaster Universities Collaboration for Public Health Research. We have the NIHR Applied Research Collaborative for the North West Coast, or the ARC North West Coast. We also have we are a WHO Collaborating Centre for Policy Research on the Determinants of Health Equity, involved in the Children Growing Up in Liverpool Birth Cohort, or SEAGUL, and we host a part of the Civic Data Cooperative, and FIRST, which is a team of researchers from Liverpool and Lancaster collaborating with directors of public health and members of the public to deliver a public health intervention responsive studies team. And finally, the Civic Data Cooperative is a data governance project funded by the Liverpool City Region Combined Authority. It connects organisations and citizens in the region to appropriate data to improve services. But there are many more research projects going on in the department, and this is just a taster. So, a quick introduction to some key people. Our head of department is Professor Martino Flaherty, and our department is also home to Executive Dean of Institute of Population Health, Professor Sally Sheard. Our PGR team is made up of myself, Rebecca Geary, our early career researcher representative, Dr. Anna Head, and our PGR representative, Noman Khan. We also have support from Professor Rogers in that team. So the details of all of those people and some other key people are here on this screen. Our head of department, Martin, would love to have brief welcome meetings with new students. They're usually organised by Michelle, so we would invite you to get in touch with Michelle to arrange this. In the department, we also have career stage clusters and a peer review and journal club, and there are other academic leads for key areas such as impact and communications too. The full list is on the website or available from Michelle, whose details are here on the screen too. And finally, the department hosts a public health forum 3 times per month with internal and invited speakers, and there are lots of opportunities within this for postgraduate students and early career researchers to get involved, to get feedback or share their ideas. So we'd encourage you to come along to the forum, hear what people are talking about, and also get involved yourselves. So once again, sorry I couldn't be with you today, but I wish to extend a warm welcome to you all, and if you want to talk about anything at all related to PGR studies, please do get in touch. My details are on the next slide. Thank you.
Okay. Right, so we got so we were expecting this. Okay, yeah. So we've got the psychology lead who possibly is on his way. We're hoping is on his way, but we'll go on, and when he arrives, we can bring him in. Okay, so we also so as I said, there's the School of Allied Healthcare Professionals and Nursing. This is not so. Again, the lead for this is Professor Jo Patterson, who's also the Associate Dean for Research in the school, and she's also the PGR lead. She can't make it today. Has just provided a couple of slides with an overview. So this is a teaching unit primarily for undergraduate. We've got MSc pre-registration and MSc. the disciplines they could, but they also do have PhD students. I don't know, are any of you here from the school? You are, right? So some of the disciplines that are covered are diagnostic radiography, nursing, occupational therapy, orthotics, physiotherapy, therapeutic radiography, and oncology. So in terms of research, they have a professional doctorate, which is part-time, which I think at the moment has 16 students, and that's a combination of some top elements and then a thesis in I think the third year. So there are actually 9. So this has been our smallest department for PhD students, but it is increasing with currently having 9 students. 5 of them are part-time. We also have 1 person registered for a PhD by publication, PhD by prior publication, as it's called. That's one student part-time. That's a different process where you can use publications that you already have. But you know, if you're not already registered for it, you can't change to it, so it doesn't really matter from that point of view. And so the research groups that they have in the school are cancer treatment, care and recovery, neurorehabilitation, assistive technologies for health, pedagogical research and scholarship, mental health and well-being, and supportive care and pain. You'll find that mental health tends to come into almost every department in the institute. Okay, so anybody got any questions about the departments? We will get a little update from psychology, hopefully, if when Eric arrives. But I'll just move on. Anyway, so okay, any queries? No. Okay, so this slide is just so will we be making these slides available alongside the because yeah. That's the thing, because you can actually click on the links, but you will get this, and there's also and we're also recording, so we will make that available as well. Okay, so as it's already been briefly mentioned, Sally Sheard is the executive dean, so she's essentially the head of IPH, and we've also got head of operations, which is Tom West, and then from a PGR point of view, there is me, who I'm the Institute Director of Postgrad Research, and the Deputy Director is Kira Kierans, who is over here. So so you may well hear from Any other settings that would? Yeah, because it's not going to record either.
I'm speaking again, sorry.
Yeah, what was that? Yeah,
Oh,
it's bygone. Okay. Right, sorry about that. Keep an eye on that and see. Right, so the last thing I said, I think, was about the student experience administrators, Charlotte, who's here, and Eleanor, who's online, but who couldn't hear us. Okay, so I think most of the departments have actually mentioned. Oh, Eric, you're here now. Actually, so we do have our psychology lead now. So do you want to come up and say something now before I move on? Yeah. No, it's fine. I think you had said you could only get there. It's fine. No, we've only just finished the departments. Do you want to take that?
I have a slide, but I kind of feel like I'm very afraid of this computer at the moment and putting my slide on. So I may not.
Just say it.
Yeah. Yes. So I'm Eric and I'm in the psychology department and I'm the PGR lead for anybody in this room or online that has just started as a PhD student in psychology. And I guess that the main thing is just to introduce myself. And if you do have queries around the department, then I'm probably the best person to speak to. I'm sure you've had lots of other points of contact and who you should turn to when you need or want specific things. But I guess I would be best placed if you have a general query about life in the psychology department or similarly about your IPAP reviewers, because I'm the person that allocated your IPAP reviewers to you for new psychology people. And I'm always around if you have any questions about that process as well. And I mean, the only other thing to say, how many people are actually in psychology in the room out of interest? Oh, it's only 3. Okay, right. Okay, and then maybe some people online. One of the common questions that people have is kind of how they fit in to the department with the research groups and that element and within the departmental structure. So I actually know 2 of you already because you're doing PhDs with me. What about you? Are you right? Okay. So I guess, and also for anybody at home or away from campus at the moment, the key thing is that the department kind of has these individual research groups, and as a PhD student, if you don't feel like you perfectly fit within the name of your research group, that is really not a big deal whatsoever. They're very kind of broad terms that try and capture what lots of academic staff do in the department. By speaking to your supervisor, you'll get a feel for how your research group functions. So some research groups have monthly seminars and monthly meetings. Others don't necessarily do that, and they might have occasional meetings. So if you're interested in kind of like how your research group functions or what opportunities there are to speak to other students and staff members in your research group, then the most sensible thing to do is to have a chat with your supervisor and see what the lay of the land looks like. And I think that's it. I don't think there's anything else that I could tell you that's interesting or useful. So I'll pass back to you.
Okay. Still, is this on? Yeah, I think it's. Okay, so I think we've already. So some of the departments have mentioned the main department contacts. So we've got the heads of the department here. I think most of you mentioned. We've also got in psychology Joe Harold as the head of the department, but and Rebecca Rylands Graham in the School of Allied Health Professions and Nursing. But your first point of contact generally would be the PGR lead. In terms of student reps, okay, so we have there's a number of so we are always looking for student reps. So if any of you are keen to get involved as student reps, please either talk to your department lead or talk to one of the existing student reps in your department if you have one. The school doesn't at the moment, I think. So we've got a couple of, so there's a number of committees that student reps are invited to. So I think Gemma already mentioned, actually, the primary care mental health have a PGR committee within the department. A lot of departments don't, I'm not aware of other departments that have that formal one. I think there might be something in public health as well. But there is an institute level postgraduate committee, and we want to have student reps from each department on that. And there's also a faculty level PGR committee, and we generally want a student rep from somewhere from the institute to be at that. So from the institute level, so Alice, who's at the back, has been acting as our, actually just seen that link's not missing an O for, so you'd probably spot that in Alice's email address. Has been acting as the institute representative at the faculty, and Alice is going to talk to you a bit later as well. Although Alice will be stepping down by the end of this year. So we will be looking for someone else to represent the institute at the faculty committees. As I said, we're also right. All right. Yeah, I'll give you some last one. Thanks. Okay. So yes, so basically there will be more once we've got all the student reps sort of established for the year. But if you are keen on getting involved, then talk to other student reps or talk to your department lead. And I think you also will probably all have received emails asking if you are interested in being a student rep from the IPH PGR admin team. Okay, so just a bit now about some of the things that you need to know as you're going through the PhD. You're probably already aware of Liverpool Life, because I think that's how you need to register, isn't it? So, but there's various things on there that you may not have used yet, like requesting official documents if you need them, for example, letters for council tax and things like that. So there's some links there. You may have already had contact with IT services, but they have various support services, and you'll get these slides which have some of these links. There's a quick start guide to how you get started. There's some IT training available, and also there's if you have any IT queries or any, then there is the self-service portal, which will give you some answers to frequently asked questions, but you can also use that to ask for help if you can't find the answer to your question. And they've also got an online chat facility which is linked there. Okay, so in terms of the student requirements, so you will, so fundamentally, and we bring this back later, but you need to be checking your email, your student email regularly. So everything important will be sent to your university email. If any of you are part-time members, where you're members of staff and also a student, sometimes you will have two email addresses, which can trip people up sometimes. I mean, if you don't want to check both of them, you can set one up to forward to the other one. But basically, you need to be checking your email regularly and reading the emails, because there's a lot of important information will be sent to that. So the first things that you're sort of required to submit will be the project design plan, development needs analysis, and your data management plan. And information about completing this will be sent to university email if it hasn't already. You have to submit this, I think is it within 3 months of registration, you have to submit these things. So you need to, your project design plan will basically define your research project and talk about particularly what you plan to do in your first year. And your development needs assessment is about basically a list of things where you feel you may need additional training. and you can agree that with your supervisor, and then they can look at options for that. And for a data management plan, there is a tool, DMP Online, which is supported by the university. So as you may already know, you are required to meet with your supervisor at least once a month or once every other month if you're part-time. Usually people will meet more than that, but you need to record at least that minimum amount in the PGR toolbox and sign them off by the supervisors. And that this will, if you don't, this will cause a problem when it comes to re-registering for the next academic year. Okay, and then you've got your portfolio activity, which is an online record of training and professional activities you can use. Okay, so I think it's already been mentioned about the IPAP, which is your independent progress assessment panel. It says it there. So you will, you may all have already been, but if not, you will be soon assigned 2 members of staff who are not involved in your supervision, who will be your IPAP panel members. You should contact them once you know who they are and arrange a meeting, which is usually around, well, it's to discuss the documents we've already mentioned, like the project design plan, development needs assessment. And you need to arrange a meeting to discuss that within 4 months of registration. So say you've got to submit these documents within 3 months, and you need to then have, and it's not a formal meeting in that it's related to your assessing your progress, but that happens in May generally. So when it comes to, so the initial meeting is just to meet your IPAP members and have a look at the project design plan, development needs assessment. You just get to discuss that with them. In May, you will have a formal meeting with these with your panel members, which should be supportive as well. And it's an opportunity for you to discuss if you have any issues as well, and that will then feed into the next thing, which is your annual progress report. Basically, you need to do what the information that you need to submit for this IPAP for discussion with your panel. I think is different from year to year, but you will be given all the details of exactly what you need to submit. You'll have that meeting, and then after that, you will be asked to complete your annual progress report, which is through an online system where you will log in and give some information about your progress, and then that will go to your supervisor, who will also complete that with your about your progress, and then that comes to either me or Kira to do the institute level, and so there's a whole sign-off process, and that you have to go through that in order to get re-registered for next year. And that's one of the things you have to confirm in there is about the number of supervisory meetings you've had. So it's really important to make sure you've had your number of supervisory meetings that have been entered onto Liverpool Life, and so at least one a month or at least one every 2 months if you're part-time. And there's a link to more information there. Okay, so we're going to talk a bit about training now. I'm going to pass over to Kira now, who's going to go through some of this. All right.
Hi, great. Hi. So I'm Kira, and I'm actually based in the Department of Public Health Policy and Systems. So I guess I will see a number of you in different ways through different routes. I'm a social anthropologist, so I'm part of the social science and humanities community that is part of IPH as well. So when Rebecca was given the overview of the department, one of the themes she mentioned was SOFIC. So we have a kind of a fairly, well, growing group of people from disciplines like geography, history, anthropology, sociology, and so on that are now kind of fundamentally part of how we think about issues around public health, health services, and so on and so forth. So I hope there'll be many opportunities where our paths will cross, particularly around interdisciplinary concerns, and intersections. So one of the things I care about quite a lot within the university are issues around research development and training, and I have been involved in quite a lot of initiatives over the year with regard to that. So again, this is just to make you a little bit aware of the kind of suite of opportunities that are at your disposal, and so that you can sort of familiarize yourself with where they are. So you have resources in terms of the PGR development hub. So all of these things you should sort of link into and get a sense of what's there. There's a program brochure as well that's sort of set up every year, so you get a sense of stuff that's offered through that. But there are also a lot of PGR development opportunities through Canvas, through the Making an Impact program, and also through PGR Development Network. So there are different kind of opportunities for you to link in and explore what is available to you. And it is a big institute. It's a big institute of many different disciplines and many, many different approaches to doing research and to engaging with the kind of debates and concerns that sort of occupy you all. So we also have to sort of think about how that sort of very broad range of supports is articulated to you. So please do be aware that there are quite a lot of opportunities. You'll see a lot of PGR development sessions, which will kind of emerge online. So there's all sorts of things that are created through the program. And there's also PGR leadership programs. So that might be something for some of you to consider, as well as the 3-minute thesis. And there will be an annual PGR conference. So that's something that we will be kind of supplying you with information as the year goes on. One of the things I do want to kind of inform you of, because I think it often gets missed, is that it's not just about what is offered here. I mean, obviously there's a lot going on in the university, but we do have a methods and methodology platform, which is called Engage at Liverpool. And I would really recommend every single one of you to go on that website and sign up, because you will get quite a lot of information about training workshops. Many of them are online, and Engage is actually affiliated and linked up. In fact, we're one of the kind of organizing universities for what is called the National Centre for Research Methods, and that is linked to our research councils. Now, the NCRM will morph and change at the end of 2025, but at the moment, it is an absolutely extraordinary infrastructure of training. So Engage will be your access point to what is going on nationally in the UK, so that you're also can access a whole range of things with people going through similar programs in the Northwest, but also across the country. Many of these are delivered online, and many of these are delivered by academics within the institute, within the university. So I really, really strongly recommend that you sign up for Engage. You'll find all sorts of things. So we often have a lot more access to training than people are aware of. And I think it is one of the things that, halfway through a PhD, people get a little bit concerned that they're thinking, I need to figure out this landscape. Start there. It's actually a good place to start. I also am involved in delivering training specifically for PGRs. So as a social scientist and as somebody who is trained in anthropology and ethnographic methods and narrative methods, we have a short course that starts in a couple of weeks that is more orientated towards the kind of methodologies, ideas, philosophies that shape what it means to do qualitative research, but also that shapes what it means to engage across the disciplines and engage across methods. So we have a sort of a strong orientation. I don't know whether you'll have seen this cascade down through some of your supervisors. Some of you are getting a nod. That's very good. So we've been advertising it for the last while. I'm told that we're actually at capacity. However, if somebody in this room or online is still interested, it's no harm to drop us an email. It's over 6 weeks between the beginning of November and Christmas. If anybody's still interested, because we often do have people you know, fall off the list by the time it starts. So just to sort of make you aware that there is a lot going on, just be very aware of what's in your handbooks and links, and to sign up for anything that's going to give you ready-made prompts to research training over the course of the years. Okay, so I'm sure, no doubt, I will have conversations with you over the year. All right.
Okay, thanks for that. Right, so just to go through a few more things, as Ciara's mentioned, Canvas there, you will have been enrolled on the Canvas site, and there's a link to it there, and that has some opportunities and courses that you can look at through there. So worth logging onto that and have a look at what's available there. Just to mention, it's quite if you haven't already signed up for ORCID, it's worth doing that. There's a link there to sign up for free. It's basically a researcher ID that's used everywhere, and when you come to submit research papers and things, you want to have them linked to your ORCID ID. And there's more links there that you can have a look at. I've already mentioned about the communication. Make sure you're always checking your university email account. So if you do have any complaints, if you got any serious complaints against the university, there is a process, and there's a link there for the student's complaint procedure, which hopefully you won't need, but some of you might. Look, now the student handbook, this isn't quite true, is it? That the student handbook has been sent, yeah. Oh, you have, okay. Yeah. So most of the information, so you should, if you've already had the last year's student handbook, most of the information should be the same, but there will be an updated version imminently, I think, for this academic year. And that's a really good, if you're not sure about anything, a lot of the information that's in here will be in the student handbook. And yeah, if you're not already engaged with the library through their website or actually being in the library, there's a lot of resources there, including they have specific PhD sessions called Know How. So there's a link there you can have a look for their training from them. There's a well-being. So we have a postgraduate well-being officer for the faculty. Is Isla for the whole faculty? Yeah, so for the faculty, but yeah, Isla Houghton Foster. So there's a link there. So any concerns about well-being, you can contact Isla. Student services, there's a website. If there's so these are just sort of useful links. And there is some well-being advice and guidance information on there, and there's contact details for well-being advisors. So there's a confidential service for students, confidential service that's provided by Student Services. So, and you can see the confidentiality statement if you're worried about contacting anyone, and if they're then going to give any information further. There's the university has a counselling service if you felt you needed to take make use of that, and there's a link there. And then the Guild of Students has a website with lots of information for extra support and resources that are available, so have a look at that. Okay, in terms of if you're ill or if you're not able to attend the university for any reason, it's really important to let your supervisor know. And if you're not able to attend for a long period of time, it's worth considering suspending your studies, or I think they're changing it to interruption of studies now, but because that essentially stops the clock. So you've got so if you don't do that, then your deadline for final submission stays the same. So if you're if you're likely to not be able to attend for a month or more, it can be worth doing that. If you're an international student, though, it is important that you speak with international advice and guidance before thinking about doing that, because it could potentially cause issues with visas and things. So the annual leave policy for PGR students is that you can have up to 25 working days per year. You've also get bank holidays, and there's closure days around Christmas, but that's what it's in the code of practice, that you can have 25 days per year holiday, but you should basically discuss that with your supervisors, and there isn't a formal system for logging them online or anything, but it's just, but make sure your supervisor knows and is okay with when you want to take your time off. Okay, so just a few more things for me, I think. So when you log on to, you'll see what your registration status is, and basically the registration statuses are fully registered, which means you're paying full fees, and you're doing your PhD research, and you'll be registered for that for most of it. There's this, just jumping over, there's the suspended interruption to studies one, which is where it stops the clock on the study, but then if you're suspended, you shouldn't be doing any research, basically, and shouldn't be working on your PhD. Once you come to almost the time when you're almost ready to submit, usually if you've got a fixed level of funding and a fixed number, so you may be funded for 3 years, and then at the end of that 3 years, you've finished all your data collection, all your lab work, if you do lab work, and basically all you're doing is writing your thesis, you can transfer to the status submission pending, which basically means that as long as you're not actively collecting data, or if you're just basically writing your thesis, it reduces the fees greatly. So if your funding is run out and you're responsible for the fees, it's definitely worth going to submission pending, because it costs a lot less. Make sure you know your end date. I think when you come to do things like your APR, you have to click that you agree that your end date, because that is the date that you have to finish. You have to submit your PhD by, and that there's extensions. If you're suspended, then that date will move. But if you've not done that, then asking for an extension is only, they're not just routinely given extensions. Basically, you have to have a very, what we call exceptional circumstances to get an extension on that. So the standard is your standard submission date is 4 years after your registration date for a full-time PhD, and it's 6 for part-time. Yeah. Okay, so if you don't submit by this end date, there is a significant risk that you won't get your degree. So it is really important. So basically, if there's any issues that affect you, then you can speak. Well, there's all sorts of people you can speak to. You can speak to your supervisor. You can speak to your IPAP members. You can speak to your department PGR lead. You can speak to me or Kira. Or the IPH PGR admin team. Whoever generally we can. If we don't know how to sort things out, we can usually point you in the right direction. So think about timescales regarding thesis write-up, and try and write as you go along. And then, if you go beyond the time, probably your stipend, which might be 3 years, you've got to think about the financial implications. And make sure your supervisor actually looks at your, responds to your emails, and and you can harass them, because they are, by signing up to supervise you, they are committing to giving timely feedback on anything you've written. Okay, this is my final slide. So that when you come to, so this might seem a bit in the future, but you will at some point have to write a thesis, and it's always worth looking at the code of practice, because it's got a lot of information on how the thesis should be produced in this appendix. And there's all sorts of information there on that website about different aspects of postgraduate research. The code of practice is basically what needs to be followed. But you can, so in terms of the organisation, discuss it with your supervisor. when you know you're going to submit, you will need to complete what's called an intention to submit form, which is where you say, and this needs to be done at least 2 months before you submit. And then your supervisor in that will specify who your internal and external examiner will be. Then once you've done that, you'll get your Viva exam, which is a normal examination. There'll be an internal and external examiner. There may be 2 external examiners if you are also members of staff. They generally last 2 to 3 hours. It's probably about, and basically someone will go through your thesis and they will go through thesis, ask you questions, and anything you've written in your thesis could be asked about. They may also want to discuss things a bit more widely, but you should, basically you need to know your thesis inside out and be able to answer any questions, but usually you will because you've just spent 3 years writing it. Okay, and then there are basically what you get after that is the results you can get is a pass, which just means, yes, here you go, have a PhD. Minor modifications, which is by far the most common outcome, which is basically where they want you to make some minor changes and you'll have up to 3 months to do that. If it's a bit more in-depth change, a bit more serious changes, you can get major modifications, which you will have up to 6 months to do. And then potentially they can say, well, you actually need to resubmit, in which case you get a year and you will have to have another Viva. You can also fail or be awarded a lower degree, but in extreme circumstances. Okay, so that's all. So we'll have a Q&A in a bit, but we've got a couple of other people there. So what happened there? Right. So there, Charlotte's on it, so I think. Okay, do you want to come and talk? So we've got sorry, I've forgotten your name. I've not written down. Peter. We've got Peter who's going to talk a bit about health and safety. Cheers.
Good afternoon, folks. On this lovely, wet and dreary, what day is it? Wednesday afternoon. You have the pleasure of listening to me droning on about health and safety. Just changing my readers. Some of you recognise already. Hello. Just a quick overview on health and safety issues. So my name's Peter Coker and I'm part of the IPH team. We're based over in the Rathbone building on the south side of campus. Can everyone hear me okay? Great stuff. So I work with a lot of colleagues. Nicola, who's our boss. I've got Martin, Lindsay and Noemi. You probably hear from Lindsay, or may have already heard from Lindsay, as she does a lot of the admin work for you guys. So she'll send out a whole manner of paperwork for you to read at your pleasure. So whilst you're here, your health and safety is paramount with us, and it's of the utmost importance for you, for yourselves and for us. It's essential that you complete your health and safety training as soon as possible. So before you start your work in earnest, it's always a good idea to contact Lindsay or use the contacts that Lindsay sends you to get in touch with ourselves, and we'll arrange your health and safety tour guides, mainly around our building in Ellen and Rathbone. But then we've got 4 other buildings on this side of campus. So it'll be Whelan, Johnston, Waterhouse, 3, Thompson Yates. So that we show you around, as well as ERB, so there's 5 in all. So by now you should have received your email from us detailing what health and safety training is required for yourselves. If you haven't, please get in touch, and that will be on a website for iphhs@liverpool.ac.uk. So if you want me to repeat that, I can do. So it's iphhs@liverpool.ac.uk. and we'll arrange this for you to be taken through your induction. If you're lucky, you'll get one of the other colleagues. This is quite short. If you're with me, you're with me for about an hour. I say that because I go through it a little bit more than my colleagues. So I'll show you reference points of our building, which helps people navigate the buildings a little bit better. So I think it's all well and good having an induction, but if you don't know where you're going, it can be a bit daunting in our buildings, especially a building like ERB or the old Cyprus building was a classic for getting lost. It was horrible. So it's good to have points of interest that you can say. So for instance, I use a big picture of a rhino, which is in the centre of our building, and everyone will know what a rhinoceros looks like, I hope. So I use that as a reference point, and it helps people navigate the building a little bit better. Things like kitchens and bathrooms are important areas of the building that you all need to know. So I'll give you that tour. Any lab work or research involving participants must have a risk assessment done beforehand, and that's a must. You can find that on SafetyNet as well. So all the stuff that you'll need will be on the IPH website as well. So that's got to be signed off by your supervisor. You can't do anything before your supervisor signs it off, or you shouldn't be. There are exceptional circumstances, I'm sure. And that also goes for any activities that you do off campus as well. So you must have, so if you're going to do something, say, in the Royal, for argument's sake, you'll have to do your off-site campus support, campus assessment, risk assessment. Where are we up to now? This will also include travel abroad. I don't know, depending on what research you guys are doing, whether you'll have travel abroad for research, but certainly you'll have to do your risk assessment definitely before that, before you leave. Any questions at all? That's Briggsy Boss in a nutshell. Uh-huh.
Thinking, she'd be the right person because she was on there. My supervisor wasn't on there. Do you know how I can get her added onto it?
Speak to Lindsay, because Lindsay will do all the admin and she'll add it to it if it's not on there. Oh, there you go. Seeing as I don't do the admin bit on that, so I couldn't really give you a 100% answer. I could find out, but if there's someone here to help, that's fine. Thank you very much. See what else I've got on the slides for you. So with the different risk assessments, you've got your general risk assessments, you've got your project activity risk assessments, and then you've got your cost risk assessments. So they're all things that you might want to take into consideration before doing your risk assessments, because it depends what you're doing and what one you have to fill in. So always make sure that you pay attention to that one. And basically that's it for us. Office rules, like any office, it's about making sure your office is clean and tidy, make sure you can navigate around your desk. Unlike our desks in our office, we're not a great example for you guys to follow, although we should be. But yeah, that's a bit of honesty going on here. Always keep your desk tidy. There's another thing I forgot to mention. If anyone is working out of hours, now our out of hours are between 8 and 6. If you're working either side of those hours, always remember to sign in the signing in book, which is normally by the reception desk of all buildings. If you can't find it, just ask the building manager. If the building managers aren't at the desk, because sometimes they service several buildings at a time, there's always a contact number for them. And it's important that you sign these books, 1 for fire safety, 2 for your safety, which is more important than the fire really. And if there's any issues that someone needs to contact you, they can look into that book and get your details. So you'd put the date that you're going to be working early or late, the time that you came in, the time that you're expecting to leave, what room you're in, and a contact detail as well. It's no good putting your office contact unless you're doing that overtime or out of hours time in your office. So it's more than likely going to be your mobile number. And then you can always scribble that out once you've finished the hours if you don't want people to see it, if you're a bit worried that people might abuse it. That's not written in anything. That's just something I had, because I know some people are a bit wary about leaving their own personal numbers, which is totally fine. But it's there for a reason, to help support yourselves. What I did forget, the DSC, so your display screen equipment. So once you've had your induction and you've done all your paperwork, there's something on your paperwork that tells you about how you sit and use your computer and at your desk. So you can fill in that form. Your form will look something similar to this. It'll basically look something like that. So we'll have someone sitting on a chair and show you the height of the computer and how best to sit for yourselves. I know you guys will have seen this. It's not a great drawing, but that'll help you with things like the level of your computer. Do you need reading aids to help you do that? Do you need a special screen? You have like a blue screen to minimize light. So things like that. There's ergonomic chairs. There's gel pads for your wrist if you need those. There's also things like footrests as well. So if you require anything like that, you must fill in a DSC form first. Once you fill that in, we're obliged to get you that equipment. If you can't get it quick enough, harass us. I mean, it takes time for things to come through, but harass people. Get what you need. There's no good starting what you're doing if you can't really see what you're doing or you're not comfortable with what you're doing. So harass people. That's what we're here for. We're here to make your experience that much better. So by all means, come and harass us, ask us questions. We might not always have all the answers, but we can certainly go a long way to try and help. Any questions at all? And on that note, I bid you farewell. Thank you very much for putting up with me. Cheers.
Okay, thanks. So I'm going to ask Chris to come up now and talk a bit about his role as
Building dyslexia coordinator.
yeah, he's in there as well.
Yes, for some reason. Anyway, we'll not go there.
Your slides there.
So, thank you. Yes, so I was asked to talk to you about disability, students with disability, and what the university does about students with disability. So I'm Chris Kipridimos. I'm senior lecturer at the Department of Public Health, Policy and Systems. I am based in Whelan Building and on the third floor. And I am the academic disability and dyslexia coordinator for the last 5 years. That's my mail, by the way. You will receive all the slides. I also have extra slides there, which I will not present today just for time constraints. But if you're interested, you can skim through them. There are links, there are stuff like that that might be relevant. I will, right. Let's start with some kind of definitions. So first, it's what is disability, and for this presentation, actually more or less for the university and for kind of the UK courts, it's any learning difficulty or mental health issue or long-term medical condition that might require additional support. So kind of I think there is some practical terms. There is kind of Gervan mentioned Ayla that she's dealing with well-being. So if you have low mood for a few weeks, possibly this is not probably a disability if it's just for a few weeks. Okay, this is an issue. It's a well-being issue. There are ways a university will support you, but it doesn't fall under the remit of disability support. If that it's protracted and it goes months and months, and you might have a formal diagnosis, then that will actually fall under my remit as disability issue. So the other key word is reasonable adjustment, and this is practically the response of the university to help students with disability to actually level the field really. So technically, it's a provision to reduce the impact of barriers experienced by disabled students during their studies. And that means usually it is a change to the standard arrangements that we have for students that doesn't have a disability. And this is kind of not philanthropy from the university. It is a legal obligation. Okay, so there is a law in the UK. It's called the Equality Act in 2010, and actually universities have a duty to make reasonable adjustment for disabled students. If you have a disability and perhaps you went through your undergrad studies, it still might be a good idea to get in touch with the disability advisory staff that I will mention in a bit, because in PhD, during your PhD, the setting is a bit different. So you do research by yourself, you don't have practical exams, you have a vibe at the very end. So what reasonable adjustment means for undergrads might be very different to what it means for people undertaking their PhD. And the other thing is that each PhD is completely different. It is different if you do a PhD in, I don't know, in Africa doing field work versus if you do a PhD based on your computer really here in the UK. The reasonable adjustment in the two cases, you can imagine it's completely different. So the first thing that the university needs to know in order to be able to respond and provide reasonable adjustments is actually to know which students have some disability. And that means that we ask for the students to actually disclose to us whether they have or whether they think they have, and I will come to that in a bit, a disability. And I will not bother you with bureaucratic stuff and paperwork and all that stuff, but I think the easiest way, if you think you might have a disability, or if you know that you have and you want to get into the system for this university, the easiest way is through the disability courses, which are available in also building from 11 to 2 during term time, so from practically October to December, and then again from February to around May, end of May, something like that. It is a drop-in, but also you can also contact them, and if you want to make sure that you don't wait on a queue or anything, you can also contact them quickly to get an appointment. And the next thing, if the technology helps me, it's a video by one of the disability coaches, which she will describe what she does, but let's see if we have.
Hello,
it works.
My name is Viv and I'm one of the team of disability coaches at the University of Liverpool. We can help you access all the disability support you need throughout your time here. You can find us at our drop-in desk during term time in the Student Life building on University Square. You can check our web pages for up-to-date days and times. You can use our live chat to get in touch.
Here are 4 ways we can help. We can give you initial advice if you're not sure if you can access support or what that support might look like. We can give you advice on how you can get the documentation you need to go with your support request, whether this is from your GP, specialist or educational psychologist. We can also let you know if the current documents you have meet the university's requirements. We can help you to apply for Disabled Students Allowance. You can use DSA for things like equipment and assistive software, as well as non-medical helper support. We can also help you to contact your suppliers if needed. We can also signpost you to your department's disability contact or learning and teaching support officer. We can help you with your course and making sure your support recommendations are put in place. We're here to support you when you need it, so please do come and visit our drop-in desk or contact us via our live chat. Make sure you don't forget the cut-off dates for exam support. These are in mid-November for January exams and mid-March for summer exams. You must have a support plan in place by these dates to get exam support. Keep an eye on our web pages for the deadlines.
Obviously, you don't have exams, so it is irrelevant to you, that exam part. That's the simplest, best way to navigate the system. So you go to a disability coach and they will help you navigate the system in the university and outside the university. If you think you might be neurodivergent, for example, or you might have dyslexia, getting a formal diagnosis might take months because the waiting lists are huge. again, get in touch with them. We might have ways to expedite that. So it should be, it is the first point of contact, and they know what they're talking about. So use them. The other option, if it is not term time, for example, if you go to the student.liverpool.ac.uk, this is the university site, and then you might have noticed that there is a it's on the bottom, but this icon there, the student support, and if you click it, it will take you to this page where actually it's all the provisions that the university has for student support. Obviously, the disabled students, it is the one that has all the information about disabled students with disability. But also, for example, if you see at the top left, there is in crisis now. Again, it's something very urgent, not necessarily relevant to a disability or anything, but if there is a crisis, that's it will have a helpful link. So a resource for you to be aware. That's almost everything for me. This is kind of the last slide. The last slide I will present. As I said, I have more slides for you to have a look on, which might be relevant to you. But it turns out that there are a lot of students that realize that they might be neurodivergent while doing their PhD studies, and therefore they're receiving a diagnosis during their PhD years, and then we do all the reasonable adjustments. So if you suspect, or if you want to know more, or if you think that you might have a good, there are actually 2 sessions about to know more. So you can scan them with your phone. Obviously, you know how QR codes work, and you can book a place. As I said, also, if you can talk to our disability coaches, they will also be able to help. That, the other thing, it's just information for you to have some extra any links or anything you might need. But as I said, everything is included in the webpage. That's me. Thank you.
Oh, no, well, we can't, wait, yeah, let's do it at the end, we'll, wait. You're not going, yeah, okay. Okay, so we are getting close to the end now, so, I know it's been a lot of information. But so Alice is who is our outgoing PGR representative for, but is finishing but at the end of the year, the end of this calendar year, not academic year. So Alice, yes, what do you want to say? Do you want to?
Yes. Hi everyone, I'm Alice, and I don't have any slides, not because I started a computer, just because I forgot to make them, which is a bit of a bad decision on my part because you don't even have my email now, but I'll send you an email soon, promise. I just want to say welcome to all of you. Hope you're having a great start to your PhD. A PhD is such a different thing for everybody. And it's completely different to anything else. Some people choose to look at it as a job. Some people choose to look at it as just a continuation of their studies and act like they were in undergrad and just work from 10 p.m. to 4 a.m. every morning. Whatever you do, whatever fits in your schedule. So I have a couple things to say. First of all, I'm Alice. I'm the current IPH PGR rep. I was also PGR rep for the Department of Health Data Science, but I stepped down from that, and I'll be stepping down from my role in a couple of months. If anybody is interested in my role and potentially taking over, please come and chat to me. I'm happy to talk about that. But I want to tell you a bit about what PGR reps are and why we're here, first of all. So I know you heard throughout all of these presentations who's your first point of contact for each individual issue you might have. What do you do when you don't actually know what's your issue? It's when you look around your other students and see who has bumped into the same thing before, and we might be able to help guide you towards who you might need to talk to. So more than actual answers, we have points of contact to guide you towards where you need to be when what you need to find out. Last year we had a society. This year we don't have a formal society, but we will have events throughout. A couple of things I want to point towards are the collaboration request form, which is still up with varied levels of success. You've heard a lot about communication within the institute between departments and even within your department. It might be hard to know who has a particular set of skills that you might need in your PhD. And if there is something very specific that you're not very inclined to knowing in depth, I'll give an example in a second. This is the place where you can request it from fellow PhD students. In the past, that included one project, and it was from someone from public health who needed help with the production of graphs for her studies. She just thought her graphs were not great yet. She didn't have the time to develop the skills to make the perfect graphs that she wanted. So she just reached out on that form to see if anybody would be interested in helping her perfect her graphs. She was in the last few months of her PhD, so she didn't have the time to invest in developing that skill in particular. The other thing we had that we might continue depending on interest is an institute journal club. We used to meet every month. We'd choose a paper. Everybody would go and read the paper in their own time. And when we meet, we just discuss what we thought, what we felt they did right, what we would like to take away from it, and consequently what we didn't like, if there's something that they went too much in detail on an aspect that we consider not to be of interest. Okay. Okay, you've heard about the Academy, you've heard about the PGR Development Network. Those are very useful places to find courses that are gonna happen in the next year. Also want to mention that the PGR Development Network now is on Canvas only. They don't send emails unless you're registered to the Canvas course. I'm happy to include a link to join their Canvas course. Also want to remind you guys that you're still students. You can still participate in any activities in the guild. Please feel free to go to any of the societies. There's a lot of them. You don't have to have registered in the beginning of the year. You can just go now on the guild website, find all the societies that are there, and maybe choose one to go test, see if you like it, because some of them are very unique and you might find something that's interesting. You need to find hobbies outside of your work as well, because otherwise your PhD could consume you very much. Then I wanna, yeah. Last thing for me is that I wanna note that there are well-being sessions. I know the well-being ambassadors are now named something else. I don't know what they're named. But there are well-being sessions gonna be organized. I know there's a PGR coffee every month, but there are other creative well-being sessions. There were pot painting and various others, including writing retreats and so on. So there is a lot of information in this section. I feel like I shouldn't give you much more, but I will be sending an email at some point soon, hopefully, if I manage to write it all down. So yeah, does anybody have any questions? Have your student reps in all of your respective departments gotten in touch with you? Do you know who they are? Do you guys know who your student reps are?
It was on that slide.
Yeah. They
I didn't have one.
Okay.
Yeah, I'll
Okay.
that with them.
Okay, you guys know? Okay. I'll make a note of that. Maybe they should get in touch. Oh, thank
Okay.
you.
Thanks. Right. Stop sharing. Okay. Okay, so that's everything from us. So it's basically just, if you have any questions either for me, Alice, Chris, anybody, then let me know. I know it's been a lot of information, but you will get it all that you can then sort of digest it at your own pace. Any questions now? Well, if not, we can, yeah, that's everything. But you've got all the contacts, so just get in touch with anything new if you have any questions. Okay. Great, right. I will, yeah, thanks. And those online, I will stop the call now.